Welcome. Today, we're diving into the world of heart rate variability, or HRV. This fascinating metric has gained popularity in health, fitness, and wellness circles. But with its rise, a lot of myths and misunderstandings have also emerged. In this video, we'll separate fact from fiction, helping you understand what HRV really tells us about our bodies and what it doesn't. Whether you're an athlete, a health enthusiast, or just curious, you'll find clarity here. Let's start by briefly explaining what HRV is and why it matters before tackling the most common myths. Heart rate variability, or HRV, is the variation in time between each heartbeat. Unlike your heart rate, which measures beats per minute, HRV looks at the tiny differences in timing from one beat to the next. This variability is influenced by your autonomic nervous system, which controls things like stress response and relaxation. A higher HRV is generally considered a sign of good health and resilience, but it's not always that simple. Now that we know what HRV is, let's explore some myths that often confuse people. One of the most common myths is that a higher HRV is always better. While it's true that, on average, higher HRV is associated with better cardiovascular health and stress resilience, it's not a universal rule. HRV is highly individual and can fluctuate due to many factors, including age, genetics, fitness level, and even time of day. For some, a sudden spike in HRV could signal illness or overtraining. So, instead of chasing the highest number, it's more important to understand your personal baseline and trends over time. Another myth is that HRV is only relevant for elite athletes or those training intensely. In reality, HRV is a valuable metric for everyone. It reflects how your body responds to stress, sleep, illness, and even emotional changes. Whether you're managing chronic stress, recovering from illness, or simply aiming for better well-being, tracking HRV can provide useful insights. It's not just for those pushing physical limits, it's for anyone interested in understanding their body's signals. Some believe that you can quickly boost your HRV with a single night of good sleep or one meditation session. While healthy habits like sleep, relaxation, and exercise do support HRV, changes usually happen gradually. HRV reflects long-term patterns in your nervous system, not just short-term fixes. Consistency in healthy behaviors is key. Don't be discouraged if you don't see immediate changes. Focus on building routines that support your overall well-being. It's easy to worry if you see a low HRV score, but it doesn't always mean something is wrong. HRV naturally varies from person to person and can be influenced by age, genetics, and even temporary factors like dehydration or lack of sleep. What's more important is your personal trend over time. If your HRV is consistently lower than usual, it might be worth looking into lifestyle factors. But a single low reading isn't cause for alarm. Many people confuse HRV with heart rate, but they're not the same. Heart rate measures how many times your heart beats per minute, while HRV looks at the variation in time between those beats. You can have a low heart rate and low HRV, or a high heart rate and high HRV. They provide different information about your body's state and should be interpreted separately for a complete picture of your health. With the rise of wearable technology, many assume that all HRV devices are perfectly accurate. However, accuracy can vary widely depending on the device, how it's worn, and even the time of measurement. Factors like movement, skin contact, and sensor quality can affect readings. For best results, use your device consistently, follow manufacturer guidelines, and focus on trends rather than single numbers. It's a common misconception that HRV only responds to physical stress, like exercise or illness. In reality, HRV is influenced by both physical and psychological factors. Emotional stress, anxiety, excitement, and even positive emotions can all impact your HRV. This makes HRV a holistic measure of how your body is responding to all kinds of stressors, not just the physical ones. Some believe that HRV data is only useful if interpreted by a doctor or medical professional. While medical input can be helpful, most people can benefit from tracking their own HRV trends. It's a tool for self-awareness and personal health management. Of course, if you notice unusual patterns or have health concerns, consulting a healthcare provider is always wise. HRV is sometimes misunderstood as a diagnostic tool for diseases or conditions. While it can indicate how your body is responding to stress or recovery, it's not a substitute for medical tests or diagnoses. HRV should be seen as one piece of the puzzle in understanding your health, not a definitive answer. Always consult healthcare professionals for diagnosis and treatment. Despite its name, heart rate variability is about more than just your heart. HRV reflects the balance between your sympathetic and parasympathetic nervous systems, which control your body's stress and relaxation responses. It's a window into your overall autonomic nervous system health, not just your cardiovascular system. This broader perspective makes HRV a valuable tool for understanding how your whole body responds to life's demands. Some people think HRV is purely genetic and can't be changed. In reality, lifestyle choices have a significant impact on HRV. Regular exercise, good sleep, stress management, and healthy eating can all improve your HRV over time. While genetics do play a role, your daily habits matter just as much, if not more, in shaping your HRV trends. It's a myth that HRV should be the same every day. In reality, HRV naturally fluctuates due to sleep, stress, hydration, illness, and even the time of day. These variations are normal and expected. The key is to look for patterns and trends over weeks or months, rather than worrying about daily ups and downs. Some believe HRV is only relevant for adults, but it's a useful metric for people of all ages. In fact, children and teenagers often have higher HRV than adults, reflecting their generally higher resilience and adaptability. Tracking HRV can be helpful for young athletes, students, and anyone interested in monitoring their health and stress levels. It's easy to compare your HRV to others, but everyone's baseline is different. Factors like age, genetics, fitness, and even gender can influence your typical HRV. Instead of comparing yourself to others, focus on your own trends and how your HRV changes in response to your lifestyle and habits. While exercise does impact HRV, it's far from the only factor. Sleep quality, stress, hydration, illness, and even what you eat can all influence your HRV. It's a comprehensive measure that reflects your overall lifestyle, not just your workout routine. Some think HRV is a direct stress detector, but it's more nuanced. While low HRV can indicate stress, it can also be influenced by other factors like illness, dehydration, or even excitement. HRV is best used as a general indicator of your body's state, not a precise stress measurement. HRV is often used to monitor recovery from exercise, but its usefulness goes beyond that. It can help you understand how your body responds to all kinds of stress, including work, travel, and emotional challenges. By tracking HRV, you can make more informed decisions about rest, activity, and self-care. While younger people tend to have higher HRV, it's a valuable metric at any age. In fact, tracking HRV as you get older can help you spot changes in your health and adjust your lifestyle accordingly. It's never too late to start paying attention to your HRV and what it can tell you about your well-being. Some people focus solely on HRV, but it should be considered alongside other health indicators like sleep, mood, and physical activity. HRV is just one piece of the puzzle. For a complete picture of your health, track multiple metrics and look for patterns across them. Sleep quality and duration have a significant impact on HRV. Poor sleep can lower your HRV, while good sleep supports higher HRV. If you notice changes in your HRV, consider how well you've been sleeping. Improving your sleep habits is one of the most effective ways to support healthy HRV. What you eat can influence your HRV. Dehydration, excessive caffeine, alcohol, and poor nutrition can all lower HRV. On the other hand, a balanced diet and staying hydrated support healthy HRV. Pay attention to how your eating habits affect your body's signals. Emotional states like anxiety, happiness, sadness, and excitement can all influence your HRV. Emotional stress tends to lower HRV, while positive emotions and relaxation can boost it. This connection highlights the importance of emotional well-being for overall health. Illness and infection can temporarily lower HRV as your body responds to stress. Monitoring HRV can sometimes help you spot early signs of illness or overtraining. However, always use HRV as one part of your overall health assessment, not as a sole indicator. HRV is not a static number. It changes throughout the day and in response to various factors. Your morning HRV might be different from your evening HRV, and that's perfectly normal. The key is to track your own patterns and understand what's typical for you. HRV is not just for people with health problems. In fact, it's a valuable tool for anyone interested in optimizing their health, performance, and well-being. By tracking HRV, you can make proactive choices to support your body, whether you're healthy or managing a condition. While HRV can provide valuable insights, it should never replace professional medical advice. If you have health concerns or notice unusual patterns in your HRV, always consult a healthcare provider. Use HRV as a tool for self-awareness, not as a diagnostic or treatment method. You don't need the latest gadgets to benefit from HRV tracking. While wearables make it easier, there are also simple apps and even manual methods for measuring HRV. The most important thing is consistency and understanding your own data, not having the fanciest technology. HRV might seem like a modern trend, but scientists have studied it for decades. What's new is the accessibility of HRV tracking for the general public, thanks to advances in technology. The science behind HRV is well established, and its value is recognized in both research and practical health monitoring. While HRV is a great tool for monitoring stress, it also provides insights into recovery, sleep quality, and overall health. By tracking HRV, you can better understand how your body responds to all kinds of challenges, not just stress. It's a versatile metric with many applications. Some people feel overwhelmed by HRV data, but it doesn't have to be complicated. Start by tracking your daily numbers and looking for trends over time. You don't need to be a scientist to benefit from HRV, just pay attention to how your body responds to different habits and routines. Athletes often use HRV to avoid overtraining, but it's useful for anyone managing stress, recovery, or general health. HRV can help you spot when you need more rest, whether from physical, mental, or emotional stress. It's a tool for balance, not just for athletes. Certain medications, especially those affecting the nervous system or heart, can influence HRV. If you're taking medication, be aware that it may impact your readings. Always discuss any concerns with your healthcare provider and consider medication effects when interpreting your HRV data. HRV is valuable for everyone, not just those who are physically active. It reflects your body's response to all kinds of stress, including mental and emotional. Whether you're active or sedentary, HRV can help you make healthier choices and manage your well-being. While low HRV can signal stress or illness, it's not a crystal ball for predicting future health problems. HRV is best used as a real-time indicator of your body's current state. Use it to guide your daily choices, not as a prediction tool. Environmental factors like temperature, altitude, and air quality can all influence HRV. For example, traveling to a new climate or being exposed to pollution may temporarily change your HRV. Consider your environment when interpreting your data. You don't need to be a biohacker or tech enthusiast to benefit from HRV. Anyone interested in their health can use HRV to make better choices. It's a practical tool for everyday well-being, not just for those obsessed with optimization. While HRV provides valuable data, it shouldn't replace your own intuition and body awareness. Use HRV as a supplement to how you feel, not as a substitute. If you're tired or unwell, listen to your body first and use HRV data to support your decisions. Both caffeine and alcohol can temporarily lower HRV. If you notice changes in your readings after consuming these substances, it's normal. Moderation and awareness of how your body responds are key to maintaining healthy HRV. There's no magic HRV number that guarantees perfect health. HRV is just one indicator among many. Focus on understanding your own patterns and making healthy choices rather than chasing a specific number. HRV isn't just for spotting issues, it's also a way to celebrate progress. Improvements in HRV can reflect better fitness, reduced stress, or healthier habits. Use HRV as a positive feedback tool, not just a warning sign. Travel, especially across time zones, can disrupt your sleep, stress levels, and routine, all of which can impact HRV. If you notice changes in your HRV while traveling, it's likely due to these factors. Give your body time to adjust and focus on healthy habits on the road. HRV is highly individual. What's normal for one person may be high or low for another. The most important thing is to track your own baseline and notice how it changes over time. Personalized tracking leads to the best insights. We've covered a wide range of myths about heart rate variability. The key takeaway is that HRV is a powerful tool for understanding your body, but it's not a magic number or a one-size-fits-all solution. Focus on your own trends, use HRV alongside other health indicators, and remember that healthy habits and self-awareness are the foundation of well-being. Thanks for joining us on this myth-busting journey. Here's to a healthier, more informed you.